Look, Jordan, if you don't at least go to the student health center to get your hearing checked out, it could get worse.
I mean, I hear you, but...
Look, I read on page 183 in my audiology book that if you have acute pain, prolonged discomfort, or drainage, you can have a ruptured tympanic membrane.
I mean, I really don't need your help or your little citations. I got through these past 3 months just fine, thank you.
So you mean to tell me the ringing in your ear is comfortable?
I mean, no, but I don't think it's as serious as mixed or complete hearing loss.
Who cares what people think? What matters is that you're doing just fine. Here, take this.
All right. So there are so many people who develop hearing loss, even at an early age. This is called acquired hearing loss. Acquired hearing loss occurs in individuals who are hearing sensitivity and through illness, injury, or genetics develop a hearing impairment after speech and language skills are established. There are some symptoms that indicate that you may be experiencing acquired hearing loss. Such ringing in the ear is called tinnitus. Oh, so that's what it's called.
See what happens when you learn new information?
Please turn your textbooks to page 205.
I got my textbook. I got my iPad. I got it.
Excuse me, Professor Smith.
Yes, Mr. Jones.
May you repeat the page number again?
205.
Here we go again. He always asking somebody to repeat something.
Shut up, Noel. Nobody was talking to you. For all we know, he could have mixed hearing loss.
I'm sorry. Did you hear something?
Taylor and Noel, I've heard enough. And Jordan, how about you go and get your hearing checked before you walk up into my classroom? I don't have time to repeat myself because of one student. Anywho, now we will begin the review of the human ear. Who can tell me the anatomical structure between the outer and the middle ear? Taylor, yes.
The incus?
No. As you can see, the incus is a small anvil-shaped bone in the middle ear transmitting vibrations between the malleus and the stapes. Anyone else?
I might.
Noel?
The cochlea?
No.
The cochlea is the spiral cavity of the inner ear that receives sounds in the form of vibration, which causes the stereocilia to move. The stereocilia then converts these vibrations into nerve impulses, which are taken
To the brain to be interpreted. Let's guess.
The eardrum. I believe chapter 2, page 26. I think it states that the eardrum is the anatomical structure between the outer, middle, and or tympanic membrane, and it's distinct.
Correct.
Yeah, for someone whose eardrums don't even work.
You know, you've got some nerve coming at my friend like that.
And what are you gonna do about it?
Hey man, chill. Sit down. Me having a hearing problem shouldn't be that much.
All right. That's enough. That's enough. It does irritate me, y'all's constant bickering. If this behavior continues, I will drop your grades from an A to a B.
That's fine.
I mean, are you that miserable? Will make my life miserable.
This is college, not preschool.
But you don't want to act childish though. Go.
Hi, my name is Audio Jones, and I sell the best audiology equipment in the area. With my low prices, there is no competition. Period.
Period.
Hey, can I buy some equipment for my practice?
Yeah, here I have an audiometer. It is used to measure the patient's vision.
I don't think that's correct. An audiometer is used to measure hearing sensitivity.
No. I think I know what I'm talking about. And here we have cochlear implants. You just put that in the air right there.
No, those are actually hearing aids. There's a huge difference.
Sir, you're really ruining my commercial right here. And right here we have tympanometers, and this is used to test the middle ear function through a process called tympanometry. You just stick this portable probe into the thing like that while they are talking, and there, fits perfectly.
That's actually wrong again. See, you use a tympanometer by checking to make sure that the patient's ear is clear of any wax, and insert the probe into the ear. Air pressure is sent through the ear for 3 to 5 seconds, and the patient must be completely still and make no noise.
Okay, you know what? Get out of my commercial. I don't have time for this.
I should shut your whole business down. You're a fraud.
Guys, we're in the middle of filming this commercial. Get it together.
I bet you didn't even go to college. You're the fraud.
Wrong again. I graduated from the illustrious North Carolina Agricultural and Technical State University, which well prepared me for graduate school, the 1,820 hours of required service that I already completed, and made me pass my audiology practice exam. You're the fraud.
Well, A&T isn't that great of a school
do you
anyway,
mean
so
A&T
I don't know
isn't
what
that
you're
great of a
over here
school?
fronting.
Okay,
I
guys.
was flashed yesterday.
I think I failed the test. But
I
I'm
failed
not
that test.
You know.
So this morning in class, Jordan asked Professor Smith to repeat the page number like 10 times.
Really?
Yes. He told him to even get his ears checked out before he came back to class next week.
I mean, I know he was embarrassed last night on the phone. He kept asking me to speak louder and raise the volume. And I was talking to straight in the phone.
What else have you noticed about him?
Well, since you asked, Jordan had me wearing these odd headphones all the time last semester. Don't ask me why.
He might have noise-induced hearing loss.
What is that?
Well, it was originally called presbycusis, noise hearing loss, but now most people just call it noise-induced hearing loss. Many young people around our age have this type of hearing loss. It's caused by exposure to loud noises like listening to loud music.
Well, he did go to a lot of concerts last year.
Oh man, he's losing it.
Okay, now you're tripping. He's not losing his mind.
Girl, not his mind, his hearing. He may be suffering from some sort of hearing loss. There's several different types of hearing loss. There's conductive, sensory neural, and mixed.
That's a lot.
Conductive hearing loss is caused by abnormality in the external and middle ear and is characterized by the reduction of the conduction of sound to the ear. Sensory neural hearing loss is due to damage of the cochlea, and mixed hearing loss is a combination of both. Is your boyfriend too precious to go see an audiologist?
Shut up. What is an audiologist anyway?
Girl, a healthcare professional who is trained to evaluate hearing loss. I'm surprised you didn't know that since you're the world's perfect girlfriend.
Since you're so smart, how do you think you should go about seeing an audiologist?
He can set an appointment by going to asha.org or ask his mom or aunt for help.
But wait, how did you know about?
Hey, Kai.
Hey, Taylor.
Later, Kai. I don't hang with trash.
I know you are, but what am I?
Oh,
You know she's the spawn of Satan, right?
what are you talking about?
This girl is sneaky. I get weird vibes from her.
No, well, that's my friend. You're tripping. I gotta go study for physics. See you later.
Jordan called his mom to tell her about the situation with Professor Smith, and she did not take it lightly. Kim Jones, Jordan's mother, lives in town, and was able to meet Jordan at the New Student Center to further discuss the situation. But before she left to meet Jordan, she called Erica, Jordan's aunt, to vent about Jordan's situation. Let's watch, shall we?
How dare that man? We paid all this money just for him to disrespect you and threaten to drop your grade? He must have bumped his head.
Man, I just felt so embarrassed.
Most importantly, why'd you tell your aunt and I about your hearing? You do know I am a speech-language pathologist, right? Fun fact, speech-language pathology is number 28 on the U.S. and News World Report list of top 100 jobs in the U.S. According to www.bls.com, speech-language pathologists assess, diagnose, and treat and help to prevent communication and swallowing disorders in children and adults.
I mean, of course I knew that, but I just felt
Ashamed?
Well, you shouldn't be. You have an audiologist as an auntie. You know, according to audiology.org, audiologists are the primary healthcare professionals who evaluate, diagnose, treat, and manage hearing loss and balance disorders in adults and children.
Oh please, when was the last time you had a steady client?
Don't start with me, girl.
I have a doctoral degree just like you.
Yet you can't figure out how to take care of your clients. What's that name of that one client with the aphasia that you've been avoiding for a month now?
Don't start about my aphasia client.
See, it's that right there. It's probably because you don't use person-first language. If you look at page 10, you will see that the client's disability does not describe the person and to not put emphasis on the disability or impairment. The person comes first, Kim.
I'm not avoiding him. I'm just.
Ah,
What's wrong, honey?
it hurts.
Don't worry. I know someone who can help, and it's certainly not your aunt. Here, take this medicine.
Whatever, Kim. Jordan, we're just going to make sure we use evidence-based practice, which is the explicit use of the current best evidence in making decisions about the care of the patient, according to page 11.
And what would you know about evidence-based practice?
Don't start with me, Kim. I don't want to check you in front of your son again. I thought you had all your credentials. Why are you giving him this ototoxic medicine? If you did more research on ototoxic medications, then you would know that it could cause tinnitus or hearing loss, according to the Audiology Information Series on ASHA.org.
I'm really tired.
Alright. Y'all can just keep arguing, and I'm just leave.
You always think you know better than you don't know nothing. I don't like.
Hello, Jordan. What brings you here today?
Well, see, my girl, she keeps getting mad at me because I never respond to anything she says, and it's not like I'm trying to ignore her on purpose. I really just cannot hear it. So I'm here to see if I can get an audiogram too.
Well, Jordan, from the audiogram results, it looks like you have conductive hearing loss. Conductive hearing loss is caused by abnormality in the external or middle ear, characterized by a reduction in the conduction of sound into the ear. This also can affect speech perception because it alters the internal mechanism of the middle ear, which affects conduction of sound through the bone. So, based on the pictures that I showed you, a hearing aid can be used to assist with hearing loss. There are many different types of hearing aids. There's behind the ear that is worn on top of the ear. There's an ear aid that is molded to fit the shape of an ear. There are also completely in the canal and invisible ear canal aids that are designed to be less noticeable. There are also hearing assistive technology that can include assertive listening devices, auditory trainers, personal systems, classroom audio distribution systems, CADS, and sound field technology.
Can I see the audiogram?
Sure, I got it on my phone, so. Okay, sure, let me explain what everything means. So the audiogram determines the type, degree of hearing loss and its impact on speech and language development. The frequency is on the horizontal axis, which is displayed in hertz, where 250 hertz is low-pitched sound and 8,000 hertz is high-pitched sound. The amount of hearing loss is shown on the vertical axis of decibels, where the higher number of the greater degree of hearing loss is 0 to 20 decibels and are considered to be within a normal hearing range for adults.
Okay, well, thank you.
No problem. Can I speak to a girlfriend of Jordan Jones? Well, by the looks of it, Ty is the name on the consent form, so she needs to be here to hear his diagnosis.